Hi, my name is Sarah Gasco, and this is Samantha Griffith, and I'm going to explain how to do a physical assessment on the upper body. As you walk in the room as a nurse, I would identify who I am and explain to her what I'm going to do, why it's important, and how she can assist me in the assessment of the upper body. First, I would take her vital signs. I would apply the blood pressure cuff to the upper part of the arm. And then I would palpate for the brachial artery, and then I would pump it up until I can't feel the brachial artery anymore, and then I would pump it up 30 after that, and I'd use my stethoscope and listen for the sounds. I would then assess her pulse and count for 30 seconds if it's regular, and if it's irregular, I would count for a minute. Then after that, I would count her respirations without telling her I'm counting them. Then I would assess her temperature. And since I don't have a thermometer, I can just use the back of my hand. And then I would move on to the assessment phase. I would start at the head and work down in a systematic order. You want to do the least invasive first. When performing an assessment on the head, you use techniques of inspection, palpation, percussion, and auscultation. I'm going to inspect the head for symmetry of the eyes, eyebrows, and ears. And her eyebrows look normal, her ears are okay, and her eyes are okay also. I'm going to inspect her facial movements and expressions, make sure she's normal. I'm going to inspect for lesions and swelling of the eyes, face, and scalp. I'm going to palpate the head and scalp with the 3 pads of your fingers in a circular motion, noting any tenderness, depression, or masses. And everything seems to feel okay. I'm going to palpate the temporal artery for smoothness and for the pulse. Should be back here. I'm going to palpate the frontal and maxillary sinuses. And you're noting any fullness or tenderness in those areas also. And then as a specialized nurse, you would percuss the sinuses by using the index finger and tapping the frontal and maxillary sinuses. And you would know any pain that the client may be experiencing, but a generalized nurse does not have to percuss. I would then move on to the inspection of the hair. When you inspect the hair of the skull by separating it in 1-inch intervals. You're looking for the distribution of the hair to make sure it's evenly distributed, the color, make sure the color is uniform, and the texture. The hair texture can be thick or thin, both are fine and normal. And you're also looking for cleanliness of the hair also. Then I would move on to the nails. And in the nails, you use techniques of inspection and palpation. For the nails, you're going to note the color, lesions, and evidence of picking or biting the nails. And she looks like she bites her nail, so that would be something that I would then document. Then I would palpate each nail and the cuticle, shape, texture, and any sign of infection. I would assess the capillary refill, which is by pressing down on the front part of the nail to making it turn white and then letting it go. And it should turn pink within less than 2 seconds, which would be considered normal. And if it took longer than 2 seconds, I would document that also. I would also assess for clubbing of the nails. You notice this a lot in smokers, and it shows that their oxygen is poor to the tips of the fingers. She has no clubbing. It's important to notice that with the head and the hair and the nails that you document any abnormal findings, because that's what helps get to the problem a lot quicker. I would then move on to the mouth and the throat. I would use techniques of inspection, palpation, and auscultation. I will be inspecting the lips for their color, symmetry, and lesions. The mucous membrane should appear pink and moist without any lesions, which hers do. I would then inspect the mouth. I would have the client open his or her mouth, and I will inspect the teeth and the gums, and I would note any missing teeth. The tongue should be pink and moist without lesions, and I would note any mouth odor. I would have the client touch the roof of the mouth with their tongue, and I would also be looking for any lesions or nodules under the tongue. Then I would then inspect the throat, and I would be using my pin light. I'll have the client open his or her mouth. Samantha, can you open your mouth? And I'm going to look in the back of the throat and on the sides, and I'd have her make an ah sound.
Ah.
And I will inspect the throat and the tonsils and the posterior pharynx for inflammation, swelling, and lesions. You seem to be okay, Samantha. I would now move on to the eyes and the ears. For the eyes and the ears, you use techniques of inspection and palpation. For the eye, I observe the pupils, which I would then use my pin light, and I'd ask her to remove her glasses. Samantha, look straight at the light, please. And you're going to look for and see if her pupils constrict, which they should, and they did, which is normal. Then I'm going to inspect the external eye, the cornea, and I would palpate the eye. Can you close your eyes, please? And you're noting for anything abnormal, any lumps or bumps, or if there's any pressure, or if it hurts, any pain. I would then inspect the ear. I would inspect the external ear, which is the normal part of your ear, and then each ear should appear symmetrical to the opposite ear regarding size and color. I would palpate the auricle and pinna of the ear looking for nodules or swelling. Do you have any pain or tenderness in your ear?
Nope.
I would inspect the auditory canal using an otoscope, which I don't have, but when you would do that, you would pull the ear, you would pull it up and back, because that straightens the canal, and I would put in the otoscope. I would note any cerumen in canal or against the tympanic membrane, and I would note the color and the amount. Now I move on to the neck. For the neck, you use techniques of inspection, palpation, and auscultation. You want to pay close attention to the skin color and shape, and you want to note any lesions or swelling. Once again, you note any abnormal objective findings. I would inspect the carotid arteries for a pulse. She has a pulse. Now I would inspect the thyroid gland for symmetry, noting any fullness or swelling. And you're just rubbing your hands on her throat and seeing if you can feel anything. Do you have any pain or tenderness in these areas?
Nope.
Okay. Now I would move on to the heart because I'm going down the body. With the heart assessment, there's a lot of listening, so I would use my stethoscope, and you're going to listen to the aortic, the pulmonary, Erb's point, the tricuspid valve, and the mitral. These are all valves, by the way. The aortic valve is on the right side of the sternal border, and it's in the second intercostal space. So you're just listening for a normal heartbeat, and it's normal. And then the pulmonary is on the left sternal border in the first intercostal space. No, it's in the second intercostal space. Erb's point is also in the left sternal border, and it's in the third intercostal space. The tricuspid is in the left sternal border, and it's in the fourth or fifth intercostal space. And then the mitral is on the left sternal border, and it's in the fifth intercostal space. And on women, it's underneath their breast. So you just ask her to pick it up, and you can place it underneath, and you just listen. And usually it would be easier if she didn't have a shirt on or a lighter shirt, but since she's my partner and we're friends, I'm not going to ask her to take off her shirt. Now we'll also be checking for pulses. I already checked the carotid pulse earlier, but I would also check for the brachial pulse to make sure it's normal, and the radial pulse. And while I was doing the assessment of the face, I would notice any bluing if her lips were blue, or in the fingers, or if her fingers were blue, and that would also mean of a vascular problem with the heart. I would then move on to the assessment of the lungs. When assessing the lungs, you use techniques of inspection, palpation, percussion, and auscultation. The first step in this assessment is to inspect the thorax. I'm checking to see if the chest rises and falls at the same time. When you assess the thorax, you notice the skin color. Normally the skin color is consistent with the client's genetic background. First, I would inspect the right and left clavicles because they should be at the same level. And yours seem to be at the same level, Samantha. I would inspect the sternum. The sternum should be in the midline of the chest. And it's right where it should be. And then I would inspect for symmetry. Normally the right and left side of the chest should be the same size and move equally in each respiration. Big breath in, out. And it rises and falls at the same time. I would then palpate the lungs and the thorax. With the client in the sitting position, use your fingertips to gently palpate the entire thorax. And with the back, you just start at the top, and you go over, and you kind of do a zigzag motion, because then you go down. You begin above the scapula, and you palpate in a circular motion, comparing the right side to the left side. They should normally they should be the same. Then I would continue to palpate down the back. And as you move to each location, compare the same location on the opposite side of the thorax. As you palpate, you are assessing for muscle mass, any nodules or growths or tenderness throughout. Normally, the thorax is free of nodules and growths. Muscle mass is equal on both sides, and the client denies tenderness. I would also do this in the front, too, and ask for any tenderness and feeling for muscle mass. And I'd go down. And then I'm going to have the client tilt her head forward so I can locate the spinous process of C7. That's in the very back of the neck. You can feel it. When they bend their neck, there's this bump right there. That's exactly what you're looking for. That's called the spinous process of C7. The spinous process is prominent when the neck is flexed. Now I would begin palpating each spinous process as I move down the back. They should be normally aligned and straight without deviation to right or left. And if they were deviated to the right or left, I would then document my findings. I'm now going to listen to the lungs. This is the auscultation part of the assessment. Auscultation involves the listening to the client's respirations, as I would be assessing each sound for location. When I'm listening, I'm looking for the intensity, the pitch, and the duration, and any kind of characteristics, such as wheezes or anything abnormal. I would start in the front, and I start at the top. Have her take a deep breath in, out. Go to the other side. Go down. And then I will do the same thing on the back. I'm going to start at the top, ask her to get a deep breath in, and release. And then I'm going to have her do that each time. Okay. Your lungs seem to sound okay. And if you would know anything that was abnormal, you would document your findings and let the doctor know, because that could mean she could have pneumonia or an upper respiratory infection. And once again, when you're listening to the lungs, it would be easier if I could go under her shirt and listen, because it makes a huge difference with just having clothing. But to demonstrate where I was putting the stethoscope, I left it on top of her shirt. After this, I would then go to examine her breasts, but I'm not going to ask my friend if I can look at her breasts. So when I'm looking at her breasts, I would notice the color, the size, and the symmetry. And I would be looking for and palpating for any masses, nodules, moles, and venous patterns. And then I would inspect the nipple. And I'd have her raise her arms over her head. And I will inspect the breast for any dimpling, masses, or variations. And then I would palpate. I would use the palpation technique. And I would only expose one breast at a time so she doesn't feel uncomfortable. And I use the pads with the first 3 fingers. And I do it in a circular motion. And I'm noting for any tenderness or any masses. And if you find any, you once again document anything abnormal. And then I would go on to the axillary. And that's palpation also. I'm noting any swelling, lumps, or masses. There are many lymph nodes located underneath your armpit. And it's important to note those because that can lead to a serious problem later. And I would note the presence of hair, rash, or lumps or lesions. And the axillary also. And while you're doing all of these assessments, you also want to look at skin. For the skin, you use inspection and palpation. You want to note the cleanliness, odor, and sheen of the skin as you assess. You inspect even skin tones across the body for vascular markings and lesions. And once again, I'd have to ask her to remove her shirt so I could see all of her skin, but it looks to be okay. And then I would palpate. I would assess temperature, moisture, texture, and sensitivity, but you always use the back of your hand, because the back of your hand where you have the most sensitivity. And then I would inspect her skin turgor, and you would just pinching the skin and releasing, and it should be less than 2 seconds. Wait, pause. And if you notice any skin lesions on the skin, you could use the ABCDE method to describe this lesion when documenting. The A stands for asymmetry, the B stands for border, the C stands for color, the D stands for diameter, and the E stands for evolving. This then concludes my assessment of the upper body. Thank you.